So if your parent takes Advil, Aleve, or just a little ibuprofen, you need to hear this. That pain pill that felt safe at 40 can quietly become dangerous at 70. And the first sign is sometimes a fall, a bleed, or the emergency room, because I've seen many there. Hi, I'm Suzanne Fasella, and I'm founder of Caregiver Haven in the Haven community, where our members ask me for whatever challenges they need help with. For 25 years, I've helped seniors and their families navigate aging as a physician assistant in geriatric care, emergency medicine, urgent care, and family practice. So if you like what you hear, please subscribe to the channel and give it a thumbs up, and then share it with people. And this tells YouTube to share it with others as well. So let's talk about the big question. What is safer for seniors, Advil or Tylenol? And here's the simple truth. Pain pills just don't go to your knee or your back. They travel through your whole body. Your liver processes them, and your kidneys have to filter out the ingredients. And as we age, kidney function naturally declines. That means the medications can stay in the body longer, and they're going to build up faster. Why this matters is simple. What used to be a normal dose can slowly become too much, even when you're following the label. Now let's talk about Advil and Aleve. Advil and Motrin are ibuprofen. Aleve is naproxen. These are called NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. That's what it stands for. Non-steroids, anti-inflammatory, they take down the inflammation, drugs, NSAIDs. They reduce inflammation and they work really well for pain. But for older adults, NSAIDs can cause 3 problems that show up all the time. First is kidney stress. NSAIDs reduce blood flow to the kidneys. If your parent already has weaker kidney function, these meds are going to push them into trouble faster than you think. Their kidneys are going to shut down. Second is stomach bleeding. This one can be silent. Some seniors don't feel the classic stomach pain. Instead, you see fatigue, dizziness, weakness, dark stools, or they suddenly look pale. This is they're bleeding inside and you can't see it on the outside. I saw this often in the ER with construction workers. They pop Advil all day long on an empty stomach because of the pain they feel and their hard work. And then they show up one day in the emergency room. We're doing emergency surgery on them. They're bleeding out in the stomach, and sometimes it was not a good ending. So, and these are young guys. So taking Advil, especially on an empty stomach, but for an older adult, taking it over and over again is not a good idea. The stomach lining isn't what it used to be, and they look pale. They're bleeding out. You're looking at their CBC test, and it ain't good. All right, the third is heart and blood pressure strain. NSAIDs raise blood pressure and increase heart risk, especially if your parent already has heart disease or a high blood pressure. So this is going to raise it. This matters because families often say it's over the counter, so it's got to be fine. But over the counter does not mean low risk for seniors. It never has. Benadryl became an over-the-counter prescription in 1985. There was a reason it had a prescription on it before that, because it had side effects. It still does. So for most seniors, acetaminophen, Tylenol, is usually the safer first choice when used correctly. You can have Tylenol toxicity. Tylenol does not irritate the stomach lining the same way, and it doesn't stress the kidneys like NSAIDs do. But safer doesn't mean no risk at all. Tylenol's big risk is the liver, and too much can cause serious liver damage. So if you have a senior who drinks and then does the Tylenol, the liver is working overtime. And here's the trap that catches most people off guard. Acetaminophen is hidden in a lot of products. It's in cold medicines, it's in sleep aids, and some prescription pain combinations. So it's out there a lot of times. So people accidentally stack Tylenol from multiple different medications together. They don't realize it throughout the day. That's why tracking each and every one of these is so important. Once you track them and you go to the pharmacy and say, how much Tylenol is my loved one actually taking, you're going to be shocked when you see that it's hidden in so many different things. So you want to spot these duplicates, and you want to be able to walk into the doctor's appointment with that clarity that I'm talking about instead of the guessing. And you're going to find the link in the description. So grab that medication safety and savings checklist book. So if your parent must take an NSAID occasionally, you never take it on an empty stomach, as I indicated before. Food acts like a buffer for the stomach lining. So I'd rather have the pill land on the food than the lining. This still can cause irritation, but you're going to lower the chance of that stomach bleed and end up in the emergency room and in surgery. Okay? Many people will take their pills with coffee. That's not food. And so they're risking stomach bleeds or worse. So don't skip these meals. When it says you got to take it with food, take it with food, not coffee. Menthol creams have a cooling sensation that distracts the brain from pain. There's also the capsaicin that you can take over the counter. And over time, this helps with pain. But you have to use it consistently. Again, does it come with side effects? You have to ask the pharmacy. Topicals matter. These creams matter because they target the pain area, and they have much less effect on the whole body. And that's sometimes why we use a lot of them. The best thing is heat or ice. If you need to heat muscles because they ache, heat is great. If you need to cut down on inflammation like a joint or a bad heel or a foot swelling, ice is great. Okay? Even 5 minutes of gentle movement a day can help joints feel less stiff and reduce pain overall. I've seen patients come in with their shoulders creaking and cracking and grating bone on bone, and I start them on exercises. They come back like 6 weeks later and they go, look, and I'm like, what am I looking at? And they're swinging their arms and they're like, no creaking and cracking anymore, Suzanne. And I'm like, oh my gosh, just that 5 minutes a day. Some of them tell me they did it while their breakfast was cooking. Their eggs were on the timer. They'd swing their arms. It's amazing how the body is very resilient. So again, heat helps with stiffness. Ice helps with swelling and pain, and both help with pain. So these simple tools are going to make a real difference. So the quick reminder is just don't forget the medication safety and savings list, and don't forget your pharmacy appointment. One point, do not ask the pharmacy technician. They are not skilled. They did not go to school for 5 years, graduate school. They did not go through clinical research, clinical studies to learn all this stuff. Only the pharmacist can give you this information, not the pharmacy technician. Ask who you're speaking to. All right? Make sure you're looking for the ibuprofen, the naproxens, the NSAIDs. Pay attention to the patterns, the dizziness, the new fatigue, the paleness, the higher blood pressures. Watch for stomach bleeds like weakness. They stop eating, the pale skin, the dark stools. And look for the hidden acetaminophen in all the cold medicines and the sleep products. And then try a topical option instead and ask the doctor about that. Then bring the list to the pharmacy first and then to the doctor and say, you know what, I'm done guessing. I want to know what I'm doing to my parent. And are you hurting them or helping them by using these over-the-counter drugs? So again, Tylenol is often safer, but only if you avoid the hidden duplicates in it, because it can lead to Tylenol toxicity, which I have seen in the emergency room. It is not a fun thing to watch somebody go through. You don't want to end up in the emergency room. Nobody does, and nobody wants to be hospitalized either. If you have any questions, let me know. Leave your comments below. I do read them, but I want you to have a safe and confident and calm conversation with these doctors and pharmacists. That's what they're there for, and you have a right to ask these questions. Take care, and we'll talk soon. I'll see you in the next video. Bye-bye.